looking at some of the things related to clinical management of pain. We discussed the rest re-injury cycle before, and this is again a situation where athletes will experience a relief in pain and then continue on their activity typically before really they're truly prepared to, and they end up causing more pain and then re-injuring the structure. So usually what you have here is, again, an absence of pain is misinterpreted as the tissue being healing. Remember that just because they're not experiencing pain doesn't mean that the area is fully ready to go back to activity. So that's an important point to emphasize, particularly with the athlete. So discussing this with them and educating them on the fact that while the tissue is on its way to healing, it's not ready to necessarily take on that full stress. So typically you have too much stress being applied, typically during the repair and remodeling phases, because that's usually when your pain has subsided more. I mean, certainly this could obviously occur during the acute inflammatory phase as well, but it's not as common because usually pain will be more of a limiting factor there. The other issue is there may not have been enough stress applied early on, so you could have it just in reverse. The individual may not have stressed the structure early enough, and then that's where maybe some of the issues with poor healing is occurring later on as the individual progresses through their treatment. Another thing to consider, and we'll talk about this when we discuss myofascial pain syndrome, is that if poor biomechanics are the cause, that has to be corrected. So again, while these modalities are useful in treating some of the symptoms that the person may be experiencing typically for pain relief, if they continue to have some type of biomechanical cause to the pain, or that's sort of precipitating their injury, that could also then impact their recovery. So that could be why they're experiencing this rest re-injury cycle, if there's something within their biomechanics that's possibly getting missed. So the biggest thing is pain is always a warning sign. So if the athlete continues to have pain with a persistent pain issue, or they had an acute injury that now has experienced either too much stress, or there wasn't enough stress early on and now they're trying to progress and they're not getting there, they're having pain, it's a warning sign, and it's always an indication that something else is possibly amiss. So make sure that if necessary, athletes get reassessed, even possibly referral if it seems like they're not getting better. Refer them back to your team physician. Okay, myofascial pain syndrome, and we discussed this a little bit. So myofascial pain syndrome is more or less, a connective tissue situation where you have trigger points forming in the muscular tissue, and usually the cause of this is multifactorial. Again, a lot of times biomechanics and overuse does become an issue with this. No single treatment is proven to be most effective. There are some things that we are going to suggest here that can certainly be utilized in the treatment of it. But again, the issue is, one, look at their primary complaint. So first of all, obviously see where they're having their pain, when they have their pain. And again, provide a progressive plan to address, particularly when they have postural and faulty movement patterns. Again, if postural issues, faulty movement patterns are causing pain and they're not addressed, then obviously the issue is going to continue, okay? And also help the person to recognize when stress and fatigue are contributing to the pain. So again, we know that stress can cause tension, particularly in the upper back and neck, and that could be a situation where that happens as well. There's certainly multiple things that can be utilized. There are myofascial release techniques, so different types of trigger point massage that can be useful. And what they recommend is with trigger points, go and do like a massage bilaterally, hit each point for about 30 to 40 seconds. You could do a similar thing with TENS, with electrical stim. And if you have the option of what's called a probe, so what a probe essentially does is kind of focuses the stim on the individual trigger points, and basically that's the parameters we have up here is what's recommended, about 2 to 4 pulses per second long phase duration. We'll talk more about this stuff when we get into TENS and electrical stim. Don't get worried about not understanding completely what that is right now. Just know that that's the protocol for TENS that they usually use. We'll go over what phase duration and all, how that impacts TENS. If you think about what we just discussed with the different forms of pain relief, though, think about what level of pain control you're looking to use here. You can also use a more conventional TENS, meaning a more sensory level TENS. Again, you'll typically get rapid pain relief with either one of those, and usually it'll last for a little while after the treatment. Again, unless you're using that level 3 pain control, you're not going to get a prolonged pain relief. And you could certainly use other adjuncts to this, heat, cold, possibly ultrasound as well. Again, the key here is just breaking the pain spasm pain cycle. And again, what you're essentially trying to resolve, particularly when it comes to trigger points in myofascial pain syndrome, is you're trying to break up, again, what they call that gamma gain. So gamma gain is just basically increased efferent. Remember, efferent is your motor input that happens when tissue's under stress. So you're basically trying to break up that cycle. And again, that could be further enhanced by improving the strength and muscular endurance in the region, because obviously part of what could be happening is if the muscles are fatiguing, particularly if we're talking for postural reasons, that could be where a lot of the pain and issues are coming up. So here we just have a picture, and they show this in your textbook. So I was talking about the release techniques, and we're going to spend a little bit of time on just some general manual therapy and talk about some of the techniques in class. This is just what they call a suboccipital release. Again, since the region most commonly affected by this is in the upper back and neck, and essentially what they're doing with it, what the treating athletic trainer is doing there is basically just doing a stretching technique for the suboccipital muscles and the fascia underneath there, basically taking his fingers and kind of pulling along the fascial lines and kind of anchoring his fingers to the base of the occiput and providing a pretty good stretch. This is a pretty good technique for individuals who maybe have like some of that chronic dull aching neck pain caused by these trigger points. And then here's just a picture of someone getting trigger point massage done to them. So essentially with trigger point massage, you're essentially just taking your thumb. In some cases people use their elbows, although sometimes the elbows are a little aggressive. Basically just putting pressure over that trigger point, over that taut area, essentially until it releases. Now, there's some that are a little harder to release and you may have to come back to them, but typically around 30 to 40 seconds over each area to kind of work that, and you'll kind of have to work multiple trigger points to treat the individual. Okay, so we talked a little bit about complex regional pain syndrome and the different types and the physiology behind it. Again, typically, especially in extreme circumstances, you're going to manage this with sympathetic blocks and different types of medication. Again, the idea here is that you have that outpouring of sympathetic outflow that's causing these signs and symptoms of extreme pain in the area, the heightened sensitivity, the circulatory issues, what have you. So the important thing here is you want to do a progressive program of pain-free, and you can't emphasize that enough, pain-free therapeutic exercise. There can't be discomfort associated with the exercise because you're just going to continue to exacerbate the problem. One of the things that a lot of people use is not per se an exercise, but one treatment approach is to actually use different types of sensory stimulus to kind of get the person used, because again, these people will have a lot of sensitivity to the area. So literally like maybe taking like a cotton ball and rubbing it along the area where they have it, and then progressing to like different types of textured surfaces, progressing your way up to maybe something that's a little bit more rough, or maybe gives a little bit more of like a sharp sensation, but that comes down the road. You tend to start very easy with, again, something like cotton to kind of progress them that way, and just gentle movement, nothing that really causes a whole lot of strain to the area. It's important to avoid cryotherapy with these people, with these patients, because again, the part of the sensation, as we had talked about when you apply cold, the aching, burning, stinging sensations would obviously exacerbate this in an individual and cause a lot of discomfort. Pulsed ultrasound TENS, manual techniques that are less aggressive. Obviously, you're not going to use something like any types of friction massage or trigger point with them. You have to use very gentle techniques. The TENS would be only sensory level TENS. You would not use any noxious level or motor TENS due to the discomfort that they cause. So you'd only be using a sensory level TENS, using level 1 pain control to treat these individuals. Just to kind of sum up, when we're going to look at chronic pain treatment, so again, chronic pain is a result of altered neural function. We discussed kind of the principles behind chronic pain. So if you're not understanding of that, go back and look at some of those causes. Continued palliative treatment may not be beneficial. Again, there may be some more extreme situations where they even need referral to possibly someone who specializes in pain management. Now, with a lot of the population that most athletic trainers deal with in sports medicine settings, we don't tend to refer a lot of our patients for pain management. Obviously, if you're dealing with a slightly older population or what would be considered non-traditional for us, that might be a route where you'd have to go. But again, just palliative modalities will not. If you're talking the pure definition of chronic pain, and remember I said sometimes people will throw chronic pain around, to describe even some of the things that, that we talk about, with like, tendinopathies, which are technically more persistent pain. Chronic pain will not be served by just trying to apply palliative modalities to it. Again, exercise can be a benefit, but again, there may be a situation where, for instance, medications may need to be described depending upon what's happening. And again, because you're dealing with a significantly altered neural function, there may need to be a little bit more done here for this patient. So it's just kind of important to keep that in mind. And wrapping up, again, pain gets modulated via neurophysiological mechanisms. So again, important to understand why pain happens, and beyond just saying, well, it happens, to serve as a warning sign. So look at the neurophysiology associated with it. Look at the types of pain control. So again, you should be able to, at the very least, have an understanding about some of the differences, what structures are involved, how do they get stimulated. In the case of level 2 and level 3 pain control, you do tend to have some carryover with that. So again, look at the different types of nerve fibers that get stimulated with that, and that should help with that. Understand that you may have to do reassessments and may need to do more physical findings to try to determine what is really causing their pain. So, don't be surprised if you have to do a reassessment with somebody if it doesn't seem like the pain situation is getting resolved. And again, therapeutic modalities aren't necessarily appropriate for all cases. Not even necessarily that you can't use them, but again, they're not going to solve as much of the problem as you may think. And there may be situations where, for instance, actual medications, there may need to be a pharmacological answer, or at least, in the short term, something may have to be used to kind of treat this. And again, don't neglect, again, the psychological point of this. Remember that pain isn't just a pure physiologic experience. There's other things that impact how a person experiences pain. So, think about how just, even something as simple, there may be some, again, positive thinking, psychological interventions that could assist with this as well. Your learning outcomes for this section. So again, make sure that you are able to kind of understand, again, these pain modulation theories are very important, and they're going to come up again. So, make sure you have a good understanding. If you have any questions or something needs to be explained further, make sure you bring it up while we're in class.